El mundo nunca se detiene. Surgen nuevos delitos y aparecen mercados ilícitos. Si queremos combatir el delito, entender las causas de la violencia, reducir la corrupción, mejorar la gobernanza, fortalecer nuestros sistemas de justicia penal y promover el Estado de Derecho, debemos contestar preguntas que no han sido respondidas. Y no podemos medir nuestro progreso sin datos. ¿Pero cómo lo hacemos? Teniendo datos confiables y exhaustivos, aprovechando los registros administrativos, realizando encuestas a la población y a las empresas. Nuestra meta es proteger al mundo y construir sociedades libres de miedo, libres de violencia, para fomentar el desarrollo sostenible.
Bienvenidos. Tercera Conferencia Internacional sobre Estadísticas de Gobernanza, Seguridad y Justicia.
Welcome to the third International Conference on Governance, Crime and Justice Statistics.
Muy buenos días. Sean bienvenidos nuevamente a esta sala oval. La primera sesión paralela del día de hoy se titula Utilizando mediciones locales para orientar y monitorear los esfuerzos para prevenir la violencia. Damos la bienvenida a nuestros ponentes y otorgamos la palabra al señor Alexander Butcher, de la Organización Mundial de la Salud, quien fungirá como moderador. Se les recuerda que pueden solicitar papeletas a nuestro personal de apoyo para formular sus preguntas. Bienvenidos.
Great. Muchas gracias and good day to everybody. As you heard, we have a session now about using local measurement to drive and monitor local violence prevention efforts. And we have three very distinguished speakers, starting with Lucia Damert, who will be speaking third. She's a professor at the Faculty of Humanities at the University of Santiago in Chile. We have Professor Jonathan Shepherd from the Oral and Maxillofacial Surgery Unit at Cardiff University in Wales and director of the Violence Research Group there. John will be speaking second. And Professor Manuel Eisner from the University of Cambridge Institute of Criminology, where he's the director of the Violence Research Center, and Manuel will be speaking first. So, without further ado, I hand over to Manuel. Manuel.
So thank you very much for the invitation to talk here. I will be talking about the question of what we know, whether evidence-based policies have a violence reduction effect, and I will be trying to argue why it is important to really think carefully about how we measure the dissemination of evidence-based policies. I would like to start with summarizing my main argument and then come back to some more specific points. The core message that I will be having is first of all that the Sustainable Development Goals expect us for the next 15 years to achieve population level reductions in violence. And that's quite a big ask from us researchers and from policymakers. What has been happening over the past 15 years is that there's been an increasing number of randomized controlled trials. There are increasingly recommendation lists about what people should do, and international actors, including WHO, UNODC, UNICEF, CDC, and so on, recommend evidence-based policy as the strategic focus. But, and that's the important thing that I will want to point out, whether evidence-based policy has a population level effect is really unknown, and one of the reasons is that we really lack good data on the extent to which local actors, national actors implement evidence-based policies. And so the main argument that I will be trying to put forth in the next 15 minutes is that we need high-resolution indicators on the diffusion of evidence-based policy across policy systems, so public health, education, social services, urban planning, and so on and so forth. So let me start with asking this simple questions. How much do we know about whether evidence-based prevention or intervention policy can affect trends in violence? And the answer is quite simple. We know nothing at all about this question. And I want to just explain this with two examples. The first example is the US crime decline over the past 15 years, which, as Nick Tilley just explained, has remained somewhat of a mystery. I want to focus here on the decline in violence rates. These are indicators from different sources on child physical abuse, child sexual abuse, homicide, violence at schools, and total violent victimization. And you can see from these graphs that these different types of violence have declined in a very similar way. I want to mention here, just in brackets, for those of you who have been in the presentation by Nick Tilley, these data pose a difficulty to the security hypothesis, I believe, because it's difficult to see how these things were affected by, for instance, burglar alarms or better security devices in cars. So what affected the US crime decline? I've had the privilege of being part of a roundtable on the crime decline in the United States, funded by the National Academies, and we have been discussing this to some extent. One of the ways I find interesting and useful to think about different explanations of the decline is to distinguish non-malleable processes, things that we can't do anything about, and on the other hand, thinking about things that we actually can influence, dedicated public health policies where politicians have said, we try to reduce actual violence levels. So what do we know about the relative effectiveness? I think what came out of the roundtable is that we have some knowledge for the United States about crime control policies. Yes, crime control probably had a positive effect, including incarceration and policing. They did contribute to the decline. There is disagreement about how much of the decline was influenced by the mass incarceration and the increase in policing. How much do we know about the contribution of violence prevention? We don't know because no data are available. And that's a big omission. And I will try to explain to you why it is a big omission. Oh, there is one, oh, sorry, maybe I can go back here. Yes. Why is it a big omission? The reason is that we do know that since about 1995, violence prevention has become, evidence-based violence prevention has become a major policy issue. It has diffused in the United States, there has been much more research, but we just don't have any indicators on the ground to measure what has been happening. So here is the second example. The international decline in bullying is much less well known than the decline in homicide rates, but here are data from the Health Behavior of School-Aged Children survey across about 20 countries, and you can clearly see that there has been a substantial decline. So I thought I can make use of these data to try to understand whether countries that invested into evidence-based bullying prevention did better than those who didn't. Again, we don't have any data on this. But we have at least something, so I tried to come up with a proxy measure, and that's the number of publications from these countries that have been trying to measure by means of randomized controlled trials whether they have an effect on bullying prevention. So I split the countries into those with a lot of research on bullying prevention and those with no research. Now the finding was that countries with no research actually did somewhat better than countries with a lot of research on bullying prevention. And again, that's a bit of a mystery. We don't understand what's going on. And I'm not saying this to discourage better evidence-based prevention. I'm saying this that we have this massive gap of high-quality data on what is happening. So how can we measure evidence-based policy in the area of violence prevention. I want to show you two approaches and some of the limitations. The first approach is by the Pew MacArthur Results First initiative, which I actually think is quite an important initiative to first of all try to encourage state governments in the United States to endorse evidence-based policies to a higher degree, but also to propose measures, ways for governments to assess whether they are making progress in evidence-based policies. They suggest to distinguish 5 different domains. One is program assessment. Do states have some recommendation lists that are relevant for local actors, that are used by local actors, and that help them to make better decisions about what they should do? A second area that they're focusing on is budget development. States now in the United States are starting to have legal requirements that schools, social services, public health services only get funding if they have some evidence base that their approach is working. And so they are trying to measure the extent to which this is the case across different states. Implementation oversight. Do the states, do local actors have any instruments to actually measure better what different actors are doing, and do they have quality control mechanisms? Outcome monitoring. Do they monitor what kind of outcomes they're producing? And finally, and only as one part of this whole package, do they conduct evaluations at varying levels of quality about whether their strategies are working? Here is the second example, and we already talked a little bit about this second example yesterday, namely the World Status Report on Violence Prevention, which is a major initiative in trying to better understand where we stand with violence prevention globally. What Alice Butchard and his team have tried to do is to get national groups of experts to assess various domains of violence prevention, including national action plans, firearm regulations, the legal framework, and the extent to which 19 different violence prevention strategies are implemented. Now I looked, so you can look at national data on the website. So I looked at the situation currently in Mexico. How is Mexico doing in violence prevention? Now those of you who come from Mexico, I would like you to make an internal guess about how good Mexico is in violence prevention. Here's the result that comes out of this study. National action plans, Mexico has, for 6 out of 6 domains, it has national action plans to reduce violence. For 7 out of 7 gun control strategies, they say they have implemented these strategies. For 17 out of 19 prevention strategies, these prevention strategies have been implemented at a larger scale. All victim support strategies are implemented at a larger scale, and national victim surveys have been done for all domains. So Mexico is almost perfect. And the question is, well, what is the problem with this kind of approach? And I just want to highlight 2 problems, I think, that are really important. I do believe that a realistic assessment of evidence-based policy requires data on actual practices delivered across social services, public health, education, and that if you do this at a high level of abstraction, you don't measure these differences, these nuances that actually happen. And the second argument I think that is important is that country-level data hide variation in needs and resources between states, municipalities, and neighborhoods. And I want to show this to you with one set of data that I only collected yesterday and I found really quite amazing. And I use the example of homicide. How much variation in homicide rates is there across the world? If we look at again the WHO data, the minimum is Singapore, Norway, Japan, Switzerland maybe, around 0.5 per 100,000. The maximum, Honduras, El Salvador, Jamaica, Venezuela, is about 50 to 70 per 100,000. Mexico has good homicide statistics, and if you look at the statistics by municipalities with a population of at least 100,000, you see that within Mexico, there is at least as much variation in homicide rates as there is variation in homicide rates across nation states. So there is, here in Merida, we are in a city that is much more similar to places like Paris, London, or Berlin than it is to other places across Mexico. So this means that there is a lot of variation in the needs, there is probably a lot of variation in the kind of prevention and intervention strategies used in different places, and we need to capture this variation if we want to understand whether evidence-based prevention policy is effective. So I want to end with just a few suggestions about what could be done to measure evidence policy in Mexico. And I want to look at two examples. One is parenting support and training. So a question I think that people, statisticians and practitioners should ask themselves is, for instance, what parent support and training services are available and what kind of resources are available. I think we need evidence on what is the evidence base for the available parent training programs. Are they good programs? Are they not so good programs? And then we need evidence about what percentage of mothers and fathers are actually using these programs. They're no good if they're just on the paper. They actually need to be delivered to those, to the target groups that need to be reached. So how could you measure this? It should be easy. It should be possible, for instance, to conduct expert interviews. That's not quantitative data. In selected cities, you could administer standardized questionnaires to child and family protection services in all states. One could assess the evidence base, reviewing literature on what is known about evidence-based programs and score the programs available currently in Mexico by how much they fit into what we know about evidence-based programs. And one could measure utilization. And that could be done, for instance, by including just, because there is not unlimited funding available for these kind of things. But for instance, the Encuesta Nacional de Victimización would be a good place to include items on the utilization of parenting supports resources, and also the recent survey on violence and delinquency would be a good place to do this. Bullying and school violence, Mexico overall as a nation is quite high on bullying levels. So what would one need to measure? What do teachers and schools do to reduce problem behavior? Do they have behavior management systems? Do they have recommendation lists for evidence-based prevention? What is the evidence base for what schools and teachers are currently doing? And what proportion of teachers, for instance, obtain training in evidence-based prevention? What proportion of schools monitor child problem behavior? How do you measure this? Here are just a few ideas. National indicator systems that track school exclusions, for instance. School exclusions, I've discovered as a criminologist that this is so important because school exclusion is such an important risk factor for later delinquency. And that's why very often school-based surveys just simply don't capture the high-risk population because the high-risk population is just not at school. Truancy levels, bullying cases, how good is the information on this? Survey and school policies administered to heads of schools, that could be done, and it could be matched to the city-based sample on the Encuesta de Cohesión Social. Measurement of utilization of recommendation lists. Does Mexico have blueprint programs for schools? And local surveys administered to teachers about program utilization. So just to come back to the main conclusion, I don't think the request for better statistical data should overshadow the actual implementation of better prevention policies. The problem is clear. If politicians are not going to do anything, there is no need to do better measurement of prevention policies. So getting politicians to actually do things is probably the first step. Only then we need, but my argument would be, then we urgently need better data on what is actually happening on the ground, because in comparison to the situation currently in the United States, where you have a decline, but we don't know whether prevention policy played a role because there is a lack of data. What we want to be able to say in 2030 is whether the efforts to promote evidence-based policy has been effective. And if we want to answer this question, we need at least some indicators that measure them. And I completely agree, and that's my last point, with the argument that Alex made yesterday. They're also important because for policymakers to have some indicators that track success, that track what has been done, is really important to keep the motivation going rather than just focusing on the bad news of violence levels. Thank you very much.
Thanks very much, Manuel, for an excellent continuation of yesterday's discussion and some very stimulating and fine questions that you've posed, and some great suggestions for how we can do more evidence-based program monitoring. Jonathan Shepherd, please, would you like to tell us about how we can use local data to prevent violence at the local level, and give us a fine example of what we would like to measure in many places?
Thank you very much for asking me to take part in this important meeting, and it's great to meet you all. Really a great privilege for me to be in this distinguished company. Now, I've been asked to wait for the slide to come, so I will talk a little bit about, I'm a surgeon, and so this violence prevention strategy and tactical approach, very practical, comes really from my perspective as a surgeon who treats people injured in violence. So this is about using data from emergency departments to measure and prevent violence. So it's about measurement and prevention in a very practical way. So nowhere is the pain and suffering and impact of violence more obvious than in a trauma centre, in an emergency department, and especially across the city. And my colleagues and I, so thousands of us across the world, treat people injured in violence. And the injury pattern is very distinctive. So in evaluation after evaluation, including in low-income and middle-income countries, as well as more prosperous countries, the face and head are the targets for violence. And so as a maxillofacial surgeon myself, then this is a real opportunity to engage with prevention as well as treatment. So we studied the recording of violence by the police and by emergency departments, and this has helped to illuminate the true extent of the dark figure of violence. And we find consistently that in high-income countries, only about half of violence, which results in hospital treatment, emergency department treatment, is known to the police. And in low-income countries, that proportion is even lower, as we've heard in the conference already. So we found in data matching studies, putting together data from the police and from emergency services in health, that police recording varies by victim age, gender and violence location. So a young man such as this person, the violence in which he's injured is much less likely to come to police attention than violence in which older people, and older women particularly, are injured. And the ICVS, the National Crime Victimisation Survey, and the Crime Survey for England and Wales all demonstrate sweep after sweep that a great deal of violence is not reported to the police. So this is a finding that really stimulated the approach I'm about to describe. Now, just one or two examples. So this is an example from Denmark, where the proportion of violence which is known to the police, which results in emergency department treatment, is very much the same as in the UK, and in fact in all Western countries where this data matching has been done, the same finding emerges, that there is the obvious argument for collecting data from emergency departments to better understand and prevent violence. We looked at the relationship between injury severity using the ISS and the abbreviated injury scores with police recording. And whilst there is a significant association, this association is weak. And just to illustrate that even the most serious violence may not be known to the police, Arthur Kellerman in Atlanta found that 13% of firearm violence recorded in his emergency department was not recorded by the police, was not represented in citywide police records. And we studied then the reasons for this lack of police knowledge, and what it boils down to is that many incidents are not reported. And they're not reported for these reasons, because of fear of reprisals, and that doesn't just involve domestic violence, but people involved in gang violence and the managers of alcohol outlets, for example. Clearly they don't want the police to know about violence in their, which affects them. The inability of injured people to identify assailants, so I don't know who hit me or assaulted, what's the point of going to the police? And clearly unwillingness to have own conduct scrutinized. So it's clear that a gang member who is injured is not going to want to report the incident to the police. And we know a lot about why violence which may be reported to the police is not recorded. And in several countries there have been efforts to standardize and improve the extent to which a report results in a police record. So there are two important implications of these findings, we think. First of all, that emergency department data about violence could constitute a new national and regional measure of violence, but most importantly, that these data could be used better to prevent violence, particularly at a local level, at a city level, for example. So I'm going to go through these one after the other. So first of all, using data on violence from emergency departments to measure violence. Now, my research group formed the National Violence Surveillance Network in the UK in 1995, and this involves the analysis of data from around 120 emergency departments, scientific sample of emergency departments across the UK. And this graph shows violence, just concentrate on the top two lines here. Violence identified in the crime survey for England and Wales, and violence identified in emergency departments. And you can see that the trend lines are pretty much identical. So this is evidence for the reliability and validity of emergency department records of violence as a new national measure. And of course these data are very largely available. We don't depend for the collection of these data on a separate national crime survey. Now, secondly, with regard to validity and reliability, this is actually a table from our paper published in Applied Economics some years ago, just to go through these as evidence of validity and reliability. So autumn, spring and winter negatively associated compared to the summer. So we know that violence is more likely in the summer, so this fits with that hypothesis. Violence, we know, is associated with major sporting events like the World Football Cup or the European Football Cup, and so that positively related. There's a negative association with alcohol prices from these data. So this again suggests that this is a valid and reliable measure, because you'd expect that there would be an inverse relationship between alcohol, beer prices and the amount of violence which results in hospital treatment. Then real house prices, that's a measure of regional prosperity, regional wealth. So again, the negative relationships. So the higher the regional wealth and house prices, the lower the incidence of violence. And then youth unemployment, that's probably reflects a link with disposable income among young people aged 18 to 30 in this particular case. So this boils down to evidence that emergency department data represent a reliable and valid measure of violence. So this has been reflected in government policy in the UK. So this is the basis of a codified information standard for tackling violence. This information collected in emergency departments is codified. Collection and sharing is mandatory across the UK according to the National Health Service contract, and they represent a new official statistic following a recent meeting of the Crime Statistics Advisory Committee in the UK. So moving now to the use of these data to actually prevent violence. So the essential elements of what's become known very gratifyingly as the Cardiff model for violence prevention are these three things. First of all, anonymized data about locations and weapons and times and days, good analysis, and thirdly, the formation and work of local violence prevention boards to translate that data into real, practical, tactical, and strategic prevention. So these are the building blocks of that enterprise. So it's about 24-hour continuous electronic data collection, precise violence location, which bar was it, which club, which street location, which park, which school, etc., times and weapons. Then those data are anonymized. Very importantly, this is not about sharing personal information with the police or any other partner, and sharing with a crime analyst by the hospital information technology team. And then police and emergency department data are then combined very simply, or even considered on separately, but certainly considered together. And then lastly, prevention actions implemented and regularly updated according to what the data are saying. So this is the Cardiff Violence Prevention Board, which is going to celebrate its 20th anniversary next year, which I have the privilege of currently chairing. I'm not going to go through all the members individually here, but you'll see in the center there our chief analyst, really, really important. On the left, you'll see the police commissioner with a link with regional policing, so that this enterprise isn't just one city, but it's a whole region. And this has been replicated across England and Wales now, and various other representatives here you'll see, including alcohol licensing officer, as alcohol availability and prices are so important drivers of violence. And this accountability for prevention amongst a group, it seems increasingly important as the evaluations continue. So it's about identifying particular, specific violence hotspots which can be targeted. So this is the center of the city in which I work, and all the tiny numbers there are alcohol outlets, but with the emergency department data and police data, we can identify the key hotspots and then target them. Now, this is an example of the data collected in London, and it illustrates that emergency department data identify or reveal hotspots which are not known to the police. So on the left there are the hotspots in East London from the emergency department data, and on the right there are the hotspots identified from police intelligence. And it's quite clear from this analysis, which is done through hot blocking, actually, because there are 29 emergency departments across London. It's quite clear that although some of the violence hotspots are the same, there are great differences. So it's obvious that the use of these data could potentially reduce violence more than is possible just using police data alone. So another example of the use of these data, this is the Gold Coast near Brisbane, and Ross Hommel and Dominique de Andrade concluded that targeted policing could be significantly improved using these data from local emergency departments. And there are examples now from cities in the United States which I haven't got time to go into, but so convincing evidence that there really is merit in using these data as part of violence prevention activity. Very important that the violence prevention boards adopt evidence-based approaches. So targeted policing, alcohol regulation, environmental interventions with a strong evidence base like public space CCTV, plastic glassware, pedestrianisation to increase the room in which often intoxicated people circulate, which we know reduces violence. Now, moving to the evidence of effectiveness. Now, this is a graph which shows the fall in violence over the past 15 years in the city in which I work. Now, this is not convincing from a scientific point of view because there's this isn't a controlled data. Thank you. But this certainly is. This is the intervention city where this approach was adopted in its place in its most similar cities according to the UK government. And we were really surprised, or pleasantly so, of course, to see the intervention city moving down to become the safest city according to this chart of woundings. Now, yesterday, Alex Bouchard mentioned the importance of interventions which have a rapidly obvious effect on violence, and so this shows this. So the 2003, the vertical line there shows when the City of Cardiff adopted this approach of using emergency department data, and almost as soon as that happened, we began to see divergence with the control cities experiencing an increase in violence and the intervention city experiencing a reduction. And this is one of the graphs from the evaluation that was published in the British Medical Journal a few years ago. With regard to hospital admissions, the rates went down in the intervention city and up in control cities. And Curtis Florence here is a health economist at the CDC with whom we collaborated on these evaluations. Now, I'm very grateful to Manuel Eisner on my left here for this graph. And this came completely out of the blue from Manuel. And it basically shows homicide rates in major UK cities. And it just happens that at the time when we were implementing this violence prevention enterprise using ED data, homicides began to fall. And this deserves further analysis, which is on the way. But this is also really encouraging data, of course. Now, partnerships to bring together police, city governments and public health became mandatory in the UK under the terms of the Crime and Disorder Act in 1998. And this provides the context for this kind of work. So how does it work exactly? Well, we think that it works by the emergency department data facilitating earlier and more frequent police intervention, keeping people out of hospital and out of prison. So that's primary prevention through deterrence, secondary prevention through police interventions in fights and arguments. But there are other mechanisms of effectiveness, so which are really important. It's not just about policing. So it's the identification and support of people injured in domestic violence, which through various means prevents repeat victimization. Identification of weapon trends, which informs weapon control, and glass bottles and glasses are an example in the UK, but this has the potential, not yet fulfilled in dealing with weapons of other kinds elsewhere. And also identification of violence hotspots, park locations and walkways, for example, which can be targeted by city governments. Now, a cost-benefit analysis on this approach has been done, and the cost-benefit ratio is really, really attractive. So spend $1 and you get $152 in return. Although this is not all cashable, but this cost-effective, this is from the evidence so far, particularly cost-effective approach. Now, here are the published evaluations for anybody who's interested. So there have been 3 so far in the UK. Some systematic reviews are relevant, so evidence that targeted policing prevents violence and has violence prevention diffusion effects, so you get this halo of prevention around the targeted hotspot. And recently, Nick Drosty and Peter Miller in Australia have published a systematic review on this information sharing approach, which is being turned into a Campbell Collaboration Crime and Justice Group systematic review as we speak. Implementation is going on, funded by the Robert Wood Johnson Foundation with the support of CDC in the United States, and there's some fascinating data and new crime maps coming out of these 3 cities. The WHO report on the implementation of the recommendations of the World Report on Violence and Health has helped a great deal to stimulate action in the Netherlands and in Australia and in the Western Cape in South Africa, for example. And there's been, as I've mentioned, some determined UK implementation. And then just finally, good to mention Nelson Mandela, isn't it? So violence can be prevented, including from the perspective of emergency departments. So if there is an emergency department near you, which is not collecting and using these anonymized data for violence prevention, then this is something for you. Thank you very much.
Thanks very much, John. I'm always spellbound by your presentation of this work, and I would wish that many more places would try to do this. But obviously, there are many barriers in certain settings around having police cooperate in such a way as they have done in England, the UK, elsewhere. Food for discussion. So now I hand over to Lucia to present on your topic. Lucia, sorry, I believe you've got to use your own mic.
Oh.
And remember to hold on for the...
Okay, hold on. Thank you for inviting me here. It's a great pleasure to be here. I just learned a lot from us in Latin America. It's always interesting to see how investment is being done in research in other areas in the world. So my presentation being here in Mexico is going to be in Spanish. And the topic is fear of crime. En general, uno de los grandes problemas que nosotros vemos en América Latina no es solamente la falta de datos, la calidad de los datos, la falta de confianza en las policías, sino también que nos hemos ido concentrando en algunos problemas de seguridad que terminan siendo como la única visión que tiene tanto los gobiernos como las acciones de política pública. Y por eso que yo en esta presentación, más allá de hablar del tema del homicidio y de las violencias criminales cotidianas, lo que me pareció importante fue rescatar el otro capítulo de las encuestas de victimización, que la mayoría de las encuestas de victimización son encuestas de victimización y percepción del delito, que la mayoría de los temas de percepción generan enormes dificultades en la conversación con el mundo de la política pública, que empieza a confundir entonces si la victimización es un hecho real o es un hecho perceptivo. Y además creo también que los temas de percepción y sobre todo los datos que nos entregan algunas encuestas de victimización nos pueden permitir avanzar en lo que se ha presentado previamente, que es mirar alternativas de política pública a nivel local. Porque no aquellos lugares donde no hay homicidios o robos a casas son lugares no violentos, ciertamente. Entonces el caso que yo voy a usar es el caso chileno, que es donde he estado viviendo últimamente y trabajando, que además encuentro que es un caso muy interesante porque pues, es uno de los países que tiene encuestas de victimización serias, hechas en el tiempo, y además presenta situaciones específicas respecto al crimen y la violencia. Si uno se concentrara solamente en datos de homicidio, como bien se ha dicho acá, Chile sería el país probablemente más seguro de América Latina. Chile es un país con tasas de homicidios cercanas a los países desarrollados, incluso en aquellos lugares donde hay alta concentración de homicidio, no supera a Perú o a Ecuador, que están alrededor de los 8 cada 100.000, y eso es una cosa muy positiva porque lo que demuestra es que los niveles de violencia no están, digamos, en el nivel más alto. También es bien negativo porque uno se tiende a quedar con la idea que, bueno, es un país muy seguro, ¿no? Que también pasa en algún sentido con Uruguay y con Costa Rica, que son países que tienden a pensar que tienen bajos niveles de violencia porque los niveles de homicidio, dada la epidemia de homicidio que tenemos en América Latina, son bastante bajos. Sin embargo, si uno mira datos de victimización 2015, uno empieza a darse cuenta que la foto es distinta. Por supuesto, tenemos países con altísimos niveles de victimización y estas son preguntas de victimización de todo tipo de delitos en los últimos 12 meses. Están países como Venezuela, por supuesto, incluso México, que tiene niveles de victimización que superan el 50% de la población. Y ahí está Chile de nuevo, ya con un nivel superior al 30%, ¿cierto?, de victimización. Esta es una encuesta, digamos, la encuesta de todos los países, no es la encuesta nacional. ¿Cuál es la diferencia posiblemente, y lo han conversado en otros paneles, que en el caso chileno los niveles de victimización son victimizaciones que no incluyen altos niveles de violencia, mientras que en Venezuela y en otros países un porcentaje importante de los hechos delictivos son hechos delictivos violentos, ¿no? Sin embargo, ya acá uno empieza a entender por qué el tema de la seguridad ciudadana es el principal tema de preocupación en Chile, ¿cierto? Cuando uno va al país y empieza a ver las encuestas de opinión y de percepción, el principal problema de preocupación para el gobierno y para la ciudadanía es la seguridad, cosa que mirando solamente los datos de homicidios sonaría totalmente contraintuitivo, y sin embargo no es así. También es cierto que la victimización en Chile en los últimos 15 años, si bien en los últimos 6 se ha mantenido constante, es evidentemente está en otro nivel que hace 20 años atrás, lo que la gente también estaría percibiendo como un empeoramiento. Lo más interesante es este gap que se empieza a abrir en el caso chileno de la gente que cree que la seguridad es mala o muy mala. Y como verán en Chile hay un montón de gente que cree que la seguridad es mala o muy mala. Más del 40% de la población cree que la seguridad es muy mala, que las cosas no se están haciendo bien, y cuando uno mira a la mano derecha el otro gráfico, se da cuenta que han habido decrecientes formas de ver las ventajas o los beneficios de la seguridad desde el 2010 en adelante. De nuevo, esto es bien extraño porque este es exactamente el mismo periodo donde los problemas de seguridad han mejorado. Los problemas de seguridad viéndolos desde el punto de vista más tradicional. Y acá es donde yo me quiero centrar en empezar a mirar qué podemos hacer para encontrarle nuevas aristas a los temas de seguridad. Si bien en este gráfico viene del 2006 en adelante, lo que muestra en las barras es los grados de victimización, es decir, la gente que dice que ha sido víctima de un delito en los últimos 12 meses, que como ven, en el 2006 era más del 30%, y ahora estamos alrededor del 28% o 26%, es decir, ha habido una constante declinación del fenómeno de la victimización, y sin embargo, la gente que cree que va a ser víctima de un crimen y la gente que cree que el crimen aumentó el año pasado, ha aumentado significativamente. Entonces, esa brecha entre fear of crime o temor al crimen y victimización real termina siendo un problema de política pública en sí mismo, más allá de las policing strategies, más allá de los programas de prevención del delito. Al final la percepción termina jugando un rol muy importante, y todos los que están acá, que trabajan en el mundo de la política pública, saben que al final todas aquellas iniciativas de política que van generando percepciones que las cosas están peor, como que establecen una barrera de cómo actuar, cómo hacer estas políticas que se decían anteriormente basadas en evidencia, cómo avanzar para incluir otros sectores como el sector salud, por ejemplo, porque se ha instalado entonces que hay un problema de percepción en América Latina en general, y yo creo que Chile es un caso bastante particular que va mostrando algunas aristas nuevas para el fenómeno de la prevención. Y acá quisiera hacer un punto. ¿Chile es un caso único? No. Como bien se decía acá hace un rato atrás, la situación de Chile es posible que uno la encuentre tal vez no en muchos países de América Latina, pero sí en muchos estados y en muchas ciudades, que son ciudades generalmente tranquilas, donde hay niveles de delictualidad bajos. Sin embargo, los niveles de percepción del delito son muy altos, y esos niveles de percepción del delito impiden muchas veces avanzar con programas y con iniciativas. Esta situación, que en el caso chileno es nacional, también si uno lo lleva al nivel local, incluso lo puede ver en determinados barrios, ¿cierto? Ya cuando uno trata de bajar a entender qué es lo que tenemos que hacer para prevenir la violencia y el crimen, lo que uno empieza a darse cuenta es que estos datos agregados, llámese el homicidio por un lado y después los delitos tradicionales preguntados en las encuestas, ya no son suficientes. Nos ayudan a generar una buena foto general del país, pero no nos ayuda a entender qué es lo que está viviendo la gente cotidianamente en términos de violencia. Y por supuesto ahí entra todo lo que se ha mostrado, el tema del bullying, de las malas relaciones interpersonales, bueno, una enorme cantidad de otros temas. Entonces, lo primero es que Chile claramente lo que nos permite es mirar un fenómeno que además, y lo reitero acá, es un fenómeno que tiene mucha estadística en las encuestas de victimización, que lamentablemente sobre eso se ha trabajado aún poco en América Latina, que los datos sobre percepción del crimen terminan siendo como, bueno, muchas veces guardados y otras veces ignorados en la discusión de qué es lo que hay que hacer para enfrentar mejor el problema de la violencia y la inseguridad. Y ahí aparecen algunas posibles respuestas para las cuales hay poca investigación en realidad. ¿Cuáles son los drivers, digamos? ¿Qué es lo que lleva a este alto nivel de inseguridad, ¿no? En México, acá donde estamos, por supuesto, que muchos me podrían decir que parte del problema es la desconfianza en el Estado, ¿cierto? Si uno siente que nadie lo cuida, si uno siente que la policía no sirve, que la justicia no es igual para todos, y que finalmente es uno, como decía el profesor Tilly, poniéndose la alarma, comprando el perro, y un montón de otras cosas en la casa para sentirse protegido, evidentemente tiene un problema de inseguridad. Pero lamentablemente no esa es la única versión. También lo que estamos viendo en América Latina es que la respuesta del mundo de los gobiernos es que la percepción es un tema de los medios de comunicación, que la percepción es mentira, que la gente se equivoca, que las cosas están mejor, que hay un montón de programas basados en evidencia que demuestran que se están haciendo cambios en la forma como se hace el trabajo policiaco, por ejemplo, y sin embargo los medios de comunicación exageran la cobertura de los temas de inseguridad. No hay ni una investigación, por lo menos en América Latina y en Chile, que corroboren esta hipótesis. Lo que hay en el caso chileno son investigaciones que han demostrado que los medios de comunicación banalizan la presencia de la violencia, la hacen cotidiana, la gente no se sorprende por lo que se muestra, pero no se podría hacer una relación directa entre mayor cobertura de medios, por ende, mayor niveles de temor o de fear of crime. Hay otra hipótesis que a mí me parece muy interesante, que se puede vincular además con algunos resultados o algunas variables que se incluyen en las encuestas, que es este debate político basado en el castigo, ¿cierto? Lo que el populismo punitivo, que está muy de moda en América Latina y en otros países también, es cuestión de ver nomás los medios en el debate presidencial en Estados Unidos, y lo que uno ve es que, bueno, el aumento de los castigos, la sensación que hay que meter a los jóvenes presos, que la ley, digamos, de responsabilidades juveniles, que muchas veces no tienen que ver con la realidad del fenómeno, pero que instalan entonces en el debate cotidiano una cantidad de indicadores que no son reales, ¿cierto? Que no son ciertos, pero que aumentan los niveles de inseguridad. En América Latina, la mayoría de las personas, según las encuestas, creen que los principales victimarios de los hechos delictuales son jóvenes y las principales víctimas somos adultos. Y en realidad las principales víctimas de la violencia en América Latina son jóvenes. Pero ese fenómeno no ha sido debatido, no ha sido incluido, y más bien lo que uno ve país tras país es que se instala una agenda de trabajo que es ojalá meter a los jóvenes presos, ¿cierto? Ojalá meter a los jóvenes en programas que los incapaciten de estar en el espacio público. Y ahí también hay una necesidad importante de empezar a poner evidencia respecto a la realidad de lo que le llamamos nosotros el populismo punitivo, el populismo penal. Hay una tercera hipótesis respecto a los altos niveles de temor que tiene que ver con que muchas veces estamos hablando, cuando hablamos de victimización, de delitos que ya son tradicionales, que son ya, entre comillas, antiguos, ¿cierto? El robo de la casa, el robo del vehículo, el robo en la calle, y sin embargo hoy día hay un montón de variedad de otros delitos, desde el cibercrimen en todos sus múltiples espacios, hasta las estafas telefónicas, hasta los amedrentamientos, digamos, hay una enorme cantidad de otros procesos delictuales que sí le afectan al individuo a pesar de posiblemente no ser una víctima directa. Y todo ese mundo de criminalidad lamentablemente no es recogido por las encuestas. Entonces uno puede decir, en las encuestas hay un mundo de víctimas de unos nuevos tipos delictuales que no se incluyen necesariamente en esta percepción de quién es entonces una persona que es víctima de un delito o qué tipos de violencia uno ve. A mí este punto me parece muy importante en América Latina, además incluyendo un tema que es fundamental para nosotros, que es la violencia de género, que muchas veces estas encuestas, digamos, que no lo incluyen, porque no tienen por qué incluirlo por un montón de temas metodológicos, terminan no demostrando las peculiaridades y la complejidad de la permanencia de los problemas de violencia de género cotidianos. Y una cuarta hipótesis que a mí me parece es la más interesante en el caso chileno por lo pronto, es la presencia a nivel local de lo que se llaman las incivilidades, de problemas de violencia cotidiana que se van generando como normales, se van normalizando, pero que en realidad afectan a los ciudadanos de forma constante. Cuando se hacen algunas encuestas, empieza uno a darse cuenta que uno ha sido víctima de un delito, no. Sus familiares han sido víctimas de un delito, no. Sin embargo, en su calle o en su barrio escucha balaceras. Sin embargo, hay gente que consume drogas en la puerta de la casa. Sin embargo, no puede su hija ir a tomar el transporte colectivo porque tiene miedo que la violen. Entonces, hay un conjunto de situaciones contextuales a nivel local que están afectando directamente a los latinoamericanos, y bueno, probablemente a mucha gente, pero a los latinoamericanos en este caso, y que los afectan en términos de su percepción sobre el sistema de justicia criminal, sobre las capacidades verdaderas de la policía y otros de hacer labores. Si esto fuera cierto, entonces la inseguridad no es un problema de las policías, ni son los ministerios encargados de la justicia criminal los que deberían de hacer las principales políticas para enfrentarlo, sino lo que hay que avanzar es a programas que más que sean de solamente prevención del crimen tradicional, avanzar realmente a programas de prevención del uso de la violencia, ¿no? Sobre todo prevención de uso de la violencia en el espacio público, que apareciera como el fenómeno más constante. Yo solo para terminar quisiera decir que evidentemente el tema del temor debe mantenerse en las encuestas, que ojalá así como se han ido aumentando preguntas respecto a los temas de victimización cada vez más afinadas, uno pudiera también avanzar en los temas de percepción. Los temas de percepción tienen incluso impactos políticos en política pública iguales que los temas de victimización, ¿cierto? Porque siempre los de victimización uno puede decir, bueno, los datos policiales son distintos y uno mata la encuesta, y sin embargo tenemos que avanzar, además de tener los datos, también hacer investigación aplicada en estos, y mirar que los niveles de temor también reflejan tres condiciones fundamentales de la mayoría de nuestras ciudades, que uno son las vulnerabilidades socioeconómicas, por supuesto, dos son los procesos de segregación urbana, aquellos que viven más segregados, aquellos que viven más encerrados tienen mayores niveles de temor, y todo eso está pues ahora muy centralizado en la forma como la gente, si ustedes van a mirar la encuesta Latino Barómetro o la encuesta La Pop que se presentó ayer, se van a dar cuenta que casi un 50% de los latinoamericanos están disponibles a tener otro tipo de gobierno que no necesariamente sea democrático, con tal de tener mayores niveles de seguridad. Y encuentro que ese es un drama, ¿cierto?, para países como los nuestros que han luchado tanto para tener gobiernos, por lo menos democráticos, digamos, que se eligen cada cierto tiempo. Entonces, desde ese punto de vista, volver a lo local, mirar y desarrollar indicadores locales que nos permitan hacer políticas, pero súper específicas, para ver qué es lo que están viviendo los ciudadanos, me parece que es un camino más efectivo que seguir avanzando con muchas veces iniciativas muy interesantes, pero de un nivel tan agregado que no llegan al ciudadano en concreto y muchas veces lamentablemente tienen caminos de ida y vuelta. Muchos de los programas o de las iniciativas que yo he visto que han sido evaluadas generalmente tienen tiempos de implementación muy cortos, no se instalan en el tiempo. Uno tiene grandes programas que tienen grandes profesores que han hecho evidence-based, desarrollos de evidence-based, y después los programas han muerto porque no han tenido la capacidad realmente de desarrollarse a otros niveles locales. Y creo que hacia ahí tenemos un desafío que avanzar, y donde además de meterle, digamos, política pública cierta, hay que también meterle mucha estadística, mucho conocimiento para poder avanzar de forma más seria. Gracias.
Thanks very much, Lucia. Your your presentation begs the question as to how much policymakers and decision makers may also share these disjunction of perception and reality, and how that influences decisions and policies. Okay, I wonder if we have any questions yet from the audience. They are coming, but I've got a couple of questions to kick off to all of you. Perhaps let's start with one for Manuel. Do you think that the measurement of evidence-based prevention might just be the next big thing in our world of evidence-based prevention and criminology and public health?
Well, whether it's the next big thing, I don't know. But I think that the movement for evidence-based policy has now arrived at a stage where we need to move beyond randomized controlled trials. They provide some kind of evidence. They will continue to be really important. But I think now, because there is a push for dissemination, there is a push for actual influence on what governments do, we need to get a better sense of what is effectively happening. And so my impression is that we don't really have a good idea of indicator systems, how to do this well. And so I think there is a big challenge for science, for research, to come up with interesting suggestions of feasible approaches to better understanding how prevention policy is changing.
There's a lesson here, actually, or there may be a lesson from the health sector. So I think it's about, so say, for example, the development of penicillin as an effective drug. So lots of randomized trials, lots of controlled experiments. So once there was convincing evidence it works, it's about careful rollout and implementation of that particular treatment. So measuring that strikes me as, and those kind of that kind of illustration, I think, is maybe important. So it's about measuring the number of prescriptions that are for penicillin that are made by doctors. So moving across to the crime and justice, it would be about measuring the prevention prescriptions that are done effectively, using the medical language, so it needs to be translated. But for me, it brings up this observation that there's an inverse relationship between, or there may be, between research and actual implementation is fascinating, and I think it probably illustrates the lack of integration of evidence production and implementation, and various reasons for that.
Yeah, well, I think that in Latin America, we're waiting for others to do the evidence-based policies, and in most cases, most governments are just looking at, UCL What Works webpage and trying to develop some initiatives that are related or similar. We have that case in community policing, we have that case in Comstat, we have many other cases, but governments that are really committed to do evidence-based policies are few. Those are like Uruguay and perhaps others, but in most cases, I think we are, at least in Latin America, I think we are lagging behind in that process.
A question stimulated by John's presentation, but perhaps to be answered by all. I wonder how feasible the Cardiff model would be in settings where there's great distrust of the police by the general population, where the police are perhaps not known for their honesty and lack of corruption when it comes to handling licensing cases in terms of alcohol regulations and what have you. Because while I can see how this works clearly from your evidence in Cardiff, experience in the Western Cape, for instance, suggests that there is a bit of resistance on the part of the police for reasons that aren't too clear. But we do know that in the Western Cape, the reputation of the police is perhaps not the same as it might be in Wales. And I wonder how much that kind of thing would be a barrier to implementing the Cardiff approach.
These are really important questions, aren't they? I think that one reason for police suspicion of this model is that there's a tendency in many police services to simply distrust the conclusion that they don't know about a whole lot of violence. So a police officer, a police commander in a large city, wherever it might be, to start with, may think, well, of course we know where the violence is. We don't need doctors in the local hospital to tell us where they are. So it's getting over that suspicion that or the fear of criticism. But I think if the data's presented, then our experience is that actually, from crime surveys, for example, my experience is that actually the police can be brought on board, especially if their primary responsibility to prevent crime is emphasized. I think also one of the benefits of this partnership approach, sitting around a table with police and emergency department, public health, city government officials, is that there's an accountability that develops for prevention, but there's also an accountability for other things as well. So, for example, in relation to ethical policing and brutality, if you're managing violence on this partnership type basis, then it's much harder for the police to behave badly. It's not a perfect world, of course, and these assertions need to be tested. But I think for me, the accountability for prevention and the accountability for ethical data sharing, ethical information sharing, ethical police activity is important.
Thanks. I'm now going to switch to a set of questions that we have from the audience. And the first two are to Lucia, and they have to do with your observations about the fear of crime versus the sort of more objective measurement thereof. And one question is, do you think that high levels of fear of crime contribute to a culture of urgency which conspires against evidence-based crime prevention? For instance, let's crackdowns and so forth.
Yeah, for sure. For sure, that's one of the cases. I think fear of crime has an impact on how policy is being made, how political discourse is being implemented, and how citizens related to another. Because fear of crime has become in Latin America the way that our cities grow, basically. The problem is that we do have information that shows you that fear of crime is perhaps not related to burglaries, but local problems. But there is not the political will to go into the local place to implement a policy. And for instance, in terms of what you were saying related to the health system, in most cases, it's not a problem of police being corrupted. It's a problem that in our culture of an state that doesn't collaborate between ministers. So you will not have, health data linked to police data. In most cases, that won't be the case. Because of of the way our state works. And of course, that should be contested. But I'm pretty sure that one of the things that moves political discourse now, and then political debate, and then policy implementation is fear of crime.
Okay, thanks. The next bunch of questions have to do with emergency department data. And to kind of put three together, they have to do with how can you do this in very, very busy emergency departments, which are kind of overwhelmed just trying to treat the patients, let alone collect data, and what is the potential for automation? And linked to that, how sustainable are such data collection systems?
Yeah, we grappled with these issues, and what we trialed the collection of data by nurses, doctors, and receptionists. They're called registrars in the United States, people who register patients. And what we found was that whilst the clinicians, the nurses and the doctors were too busy to collect the data, the registrars, the receptionists, weren't. So there is an opportunity we identified when patients register if they first come to the hospital or with accompanying people, and that's the opportunity for the receptionists, the registrars, to record these data. And those evaluations have been published in the emergency medicine literature for anybody that's interested. So that's the opportunity. Now, as far as automation is concerned, it's about amending the software that is used by the registrars, by the receptionists. And that's been done across the UK now with the introduction of this new information standard. But it's often about simply working with the information technology people in the local hospital to include the basic questions about violence, so location, weapon, times and days. And we did that. It takes a bit of work, and somebody needs to lead this. Leadership's important, and working with the information technology department in the hospital to make sure that those questions are embedded in the standard software. And then the sustainability, well, those things, of course, help sustainability, because if the software is amended and those questions become mandatory in the software, you've got to answer those questions before you move on to the next screen, then that provides sustainability. And the only other thing I'd say about sustainability of this approach is that it does need leadership. It needs senior clinical leadership and senior management leadership as well. So although the data collection and analysis and use is straightforward, in principle, it needs to be managed well. And that means that you can't just depend on somebody that's going to be only be in post for 18 months. It needs to be leadership from the permanent senior staff.
Okay, I'm afraid we're out of time at this point, but I'd really like to thank the three presenters for a really stimulating set of presentations and fine questions from the audience. Sorry I couldn't take them all on board, but an applause for the speakers, please.